All right. Today, we are talking about aesthetic patient treatments and the fact that patients don't buy treatments. They are choosing to invest their time and their money to achieve a certain outcome. I'm Amy Anderson with ACG Practice Partners, joined today by Davina Isaacs, one of our senior consultants and experienced aesthetic provider. So, Davina, thanks for being here. Before we dive into how do we have these conversations about time and money, share with our audience a little bit about your experience as an aesthetic provider.
Yeah, thanks for having me, Amy. I was an aesthetic provider for 15 plus years in the treatment room, injectable patients, neuromodulators, dermal fillers. Also did a lot of laser treatments and skincare procedures, as well as retailing a lot of skincare products.
All right. So that's important because as a consultant now, of course, you advise a lot of practices on how to conduct a comprehensive consultation, how to create treatment plans. And you're not just teaching theory, you're teaching others what made you successful for 15 years as a provider. You had a fully booked schedule, a waiting list, recurring patients who were very loyal to you. So I think that context is important because, it isn't just theory. We're sharing what we know has actually worked in your practice.
Yeah, absolutely.
Okay. So, this topic of time and money, why is it so important to have conversations about time and money when developing an aesthetic treatment plan?
Yeah, I think every patient walks into our practice, into our treatment room with two finite resources, time and money. But what's really the most interesting thing to think about is they're coming in already concerned in their head. Can I afford this treatment? How much downtime is there? How many procedures are going to be involved? And can I make it actually fit into my life? But our providers are often not talking about money because they find it to be uncomfortable. And so instead, we're creating these perfect treatment plans without building truly one that's realistic for the patient to be able to complete.
Why is it that you think providers are uncomfortable talking about money?
I think that most clinicians got into healthcare because they really want to help people and not really because they want to do sales. And somewhere along the way, um, talking about money became associated with being salesy. But I think it's very different. I think talking about money isn't selling, it's really about good planning. Because if we build a great treatment plan that's unrealistic for the patient, either else in their time or money, then we're just creating a wish list.
That's exactly right. We've got to really understand the financial component to a treatment plan because unless we're doing it for free, and we're not, then it is a relevant part of the decision making process. So, when you were a provider, how did you approach these conversations with your own patients?
Yeah, I normalized it. I simply asked the patients, as I was building out their treatment plan, I needed to understand what resources that they had available. And so I would ask, how much time do you realistically have for your skincare at home, your treatments, and your recovery? And what type of investment do you want me to keep in mind as I was building out their plan? I didn't make it awkward. It was part of the consultation process. And I explained that at every visit we were going to review had their resources changed. That way I could always be amending their treatment plan as needed. And so patients actually really appreciated that. And so they knew what to expect. Coming in, and I think it also took out a lot of the worry that I would judge them if something had changed and they weren't able to complete their treatment plan as we had originally planned it.
You make that sound so easy and so natural the way you say it. Did asking about budget make patients ever feel uncomfortable?
No, I really don't think so. I found it to be quite the opposite. I think once they understood that I wanted to take into account those resources without judgment, it became comfortable for them because then they weren't sitting in the back of their head thinking, well, she's going to build me this great treatment plan that I'm going to love, but I realistically can't afford or don't have the time to do. And so I wanted to take all of that away, just the uneasiness. And so I often found that they were really open to it. And once they realized we were going to talk about it routinely, it just became normal.
Yeah, I love that. You're absolutely right. You make a good point. If you just go straight into talking about the treatments, explaining lasers, explaining injectables. I mean, even sometimes talking about surgery, right? Sometimes there's a surgery referral made in that treatment chair. If the patient's just in the back of their mind thinking, "Oh my gosh, can I afford any of this?" Then they're distracted. They're not really listening to you.
For sure. They're running through in their head, are they going to be able to do all the treatment plan, a part of the treatment plan? And oftentimes they won't speak up on their own and they just sit there quietly. We talked about, patients quietly quitting. It also happens during the consultation. They are making the decision right there if they think they can afford it. So normalize talking about it.
And so that's the money side. Talk to me a little bit more about the time commitment. How do you have that conversation and why is that so important in the treatment planning process?
Yeah, I think this is one that really gets overlooked because time just isn't the amount of time that's in the procedure chair. It's not just the downtime, it's not how often they have to come in, but it's also the home care routine. It's, do you have time to do 8 steps at night before bedtime or 8 steps in the morning? And so we really want to be able to build the plan that they can sustain. And so that way they actually do reach their goals. um, we have to build them for every individual person, and every person has a different, resource allotment. And so I think that those are the details that really change what the treatment plan looks like in building a good treatment plan for a patient.
Yeah. I think that's such an important part of the conversation. And I'll admit, I don't know that I've had any provider besides you, Davina, ask me about the time. And of course, there's the gold standard. I do want a provider to paint the picture of for what I'm trying to accomplish. Here would be what gets me the best results. But if you don't understand that I travel a lot, I'm not going to be able to come in on any reliable schedule for repeat appointments. I'll fess up. I barely wash my face at night before I go to bed. I know the shame. But if you give me too many steps, I mean, it's just, it's going to be a stopper before I even get started. And so, that's a really important consideration about what I'm willing to do at home and how often I'm able to come into the office. Because even if I want to come in regularly for treatments, my schedule is just probably not going to allow it.
For sure. I think providers often build treatment plans that they want instead of treatment plans that the patients can actually follow. And there's a huge difference in that. And so I think the goal is to really prioritize what the patient's life looks like and what you can fit in as you're building that plan.
Gosh, that is so smart. And it ties into when we talk about we're going to build you a custom treatment plan. This is the customization part of it, right? It's not a one size fits all. It's not a one protocol fits all. It has to match their goals, their outcomes, and their time and money budget. So smart. So if practices avoid these conversations, what happens? What does that look like?
Yeah, I see this all the time where, a provider builds a beautiful treatment plan for the patient. The patient nods, they smile, they say thank you, and then they walk to the front desk and then they say, well, there's no way I can afford this. And so they don't end up booking. And so that also puts the front desk team in an awkward situation because they're not trained to develop good treatment plans. And so, as the provider, I want to know what the constraints are, what's the allowance, so that I can truly build them a good plan, that they're not just quietly leaving or feeling judged or overwhelmed that they can't actually complete the treatments that I recommend.
Yeah. I mean, the last thing we want to do is have a patient feel embarrassed or ashamed or uncomfortable, right? They're already
Mhm.
here feeling probably a little vulnerable about something that they want to improve in their appearance. And so you're absolutely right. We want to take away those barriers or anything that's going to cause them to feel uncomfortable. So I know that creating annual treatment plans has been a core part of your patient care philosophy. How does all of this fit into that?
Yeah, I just love annual treatment plans because it shifts the conversation away from just individual treatments and more into how do we, really reach your goals? How do we maintain your goals? And sometimes we might have to flex things. Sometimes we can be a little more aggressive in the number of treatments that we're doing or the amount of, home care. Other times we might need to pulse off depending on your resource availability. And so I think being able to build that treatment plan over a long period of time also keeps the patient engaged and know that we're prioritizing their goals and that we will get there. Uh,
Yeah, I say this all the time, but especially women, man, we love having a plan, right? That you saw me, you heard me, you thoroughly assessed me, and then you took the time to map out a plan that I can follow. And if I'm the one who likes to check a box off the list, right, I can go through and checklist my items as I get those treatments performed or as I use that product for that period of time. And so it doesn't have to be overly complicated, but just the concept of thinking about this is your transformation plan and it's been custom developed for me. I think it's such a powerful tool. So how do annual treatment plans benefit practices?
I think when patients have realistic expectations and a realistic plan, they stay engaged longer. Retention is higher. They're more likely to refer their friends and family. They're more, have more confidence in the provider and the practice all around. And we know if patients have better outcomes, then it's better health for the practice all around.
Yeah. And I think we would say it's probably the number one retention tool you can have in your med spa setting. And we're asked this question all the time. How do we increase retention? How do we have patients continue to come back? Well, we have to tell them what they need to come back for, right? We put the plan together and the time frame, and then it's just a matter if they agree to the plan. It's truly just, the transactional part of scheduling those appointments and maintaining the plan that you've outlined and that they've agreed to, right?
Absolutely. And we know there's never a one treatment and done with anything. Even if you were to do a, facelift, a surgery procedure, you're still going to have to maintain that result. And so we want to map that out for the patient so there's no ambiguity and they know what to expect and they can plan for it as well.
Yeah. So we started this conversation talking about the importance of asking about money and time and how much of each they're able to budget. And I imagine some of our listeners are going to ask, well, isn't it your job to recommend the ideal treatment regardless of budget? And I think that's a fair question. So how would you respond to that?
Yeah, I believe it's my responsibility to educate patients on all of their options. That does include the gold standard, but I think it's equally my responsibility to help them prioritize. Medicine isn't one size fits all, and neither are treatment plans. So sometimes the most ideal treatment plan is the best plan if it creates financial stress or doesn't fit into the patient's lifestyle. And again, if we are building them something that they cannot afford or don't have time to complete, we're just creating a wish list.
So good. If there's one thing that you want providers to remember from this conversation, what is it?
That I'd really encourage them to stop thinking about conversations around money as sales conversations and to really think about them as planning conversations to help that patient reach their goal.
Perfect. Everyone has goals, everyone has priorities, and we all have limitations, right? It just is the reality of it. So just normalize it. Don't make it something scary to talk about, but in fact, make it a very safe place that they can
Yeah.
share those things with you.
Yeah. Because we know in life, sometimes our budget changes. It often does. For sometimes it's better, sometimes it's worse. But I want that patient to have the relationship with me as the provider that they feel comfortable having that conversation. So if we need to amend things in their plan, we're working as a team together to do that.
That's right. And honestly, at the end of the day, wouldn't we much rather see a patient complete a treatment plan that they felt comfortable committing to than walking out and never even starting?
100% of the time.
Amazing. Well, Davina, I always learned so much from you. And so going forward, I'm going to feel a little bit more comfortable and confident normalizing the financial and time budget conversation with treatment plans. Thanks so much for joining us today.
Thanks for having me, Amy.